Hello everyone, Dr. Alexandra Mayer, welcome back. In today's video, we are going to be talking about female libido. It is a big topic that comes up in my office. It is a concern for women, and I think it's something that's really poorly treated. And I think people think there's a magic pill, and there's a lot to unpack in this topic. So first of all, if you like our videos, go ahead and hit the like button, drop us a comment. It really helps us just get our videos out to more women like you and help more women, which is really the goal. So without further ado, let's dive in. So female libido, right? It's one of those things where I think sex drive comes up a lot when you think about health, right? People think and will say that if you don't have a sex drive, that you can't, that you're not at an optimal level of yourself. I would actually say I do agree with that. Although I do think in women, we don't pay attention enough to the fact that libido does change throughout the month, right? There is this cyclical component with libido and the way that our hormones naturally fluctuate and the way that our body naturally responds to that. So it is normal to not be in the mood all the time, right? But it's not normal to not be in the mood any of the time. And so that's really what we're talking about today. So when women are in my office with this, there are a few things to think about when we think about libido. So first of all, it's desire. Like, do you want to? Right? Is it on your mind? Do you feel like it? Those kind of things. And then there's pain and vaginal dryness. This is a major concern for women, especially as they hit that menopausal, postmenopausal years. It's primarily associated with estrogen, and that can really put a damper on things, right? When you have dryness and atrophy and pain, it just is not as enjoyable, and patients usually do kind of shy away from that experience at that point. And then the third thing would be an inability to climax. This can also happen as women get older, and I think a lot of the time we think, okay, testosterone's the cure, like that's what we give testosterone, that's it. But there's a lot of pieces to this. So let's think about what hormones could be involved in experiencing a low libido. So testosterone is the number one thing that we think about, right? And we've done lots and lots of videos on testosterone on our channel. I think testosterone is an important addition in women, but it's not the only thing to think about when it comes to sex drive. And I think that this is where women get a little bit of misinformation, I'll call it, right? Where they're coming in and we've done a little testosterone and they're feeling better in a lot of cases, but their libido is not better. And there is this kind of mental aspect that the community has where it's kind of like, you give me a little bit of testosterone and I'm going to be ready to go. It doesn't work like that. So what other hormones play a role in this? Okay, estrogen and progesterone both play a role. We'll talk about that in a second. And then cortisol also plays a role. And that would be kind of the first one that I would dive into. If you're stressed, right, and cortisol levels are off, the first thing to go is your libido. Your body does not care if you are in the mood. It is just trying to survive. And so cortisol will be the first thing that will throw things off. That's why mind body medicine does really good for helping with libido. And why really we need to look at the adrenal output, and we need to assess stress in life and try to reduce those things, which I know is easier said than done, right? And then sometimes you have to give yourself a little grace and be like, you know, I have a lot going on right now. It makes sense that this would take a back burner in life. So let's dive into the other hormones. So testosterone. This really comes from a lot of the fact that we know that testosterone plays a huge role in libido in men. It does play a role in women, but what's interesting is that studies have shown testosterone plays a role in libido in women if it's dosed in supraphysiologic dosing, which means higher than the body would normally create. That means that we have to dose you pretty decently on testosterone to get a change in libido. And when you hear of these cases of women who are like super high sex drive and all this stuff after doing testosterone, that's usually pellets, and it's usually dosed like a crazy person. So testosterone does play a role, but the next hormone is the most important one when it comes to female libido, and that would be estrogen. If we think about in a normal cycle, in a normal cycling women, the point in the cycle where you usually have the highest libido in the majority of women is right before ovulation. What happens right before ovulation? Estrogen spikes. And so that rise in estrogen is what's causing our libido to increase. We know that increase in estrogen is associated with more vaginal lubrication, better orgasm, and more sexual desire. And the contrast of this is progesterone. So there are some women that are outliers, right? Nobody's all the same, but oftentimes in women, higher levels of progesterone will actually decrease our libido, right? Which is why usually right prior to getting our period, right, when progesterone's highest in the second half of the cycle after ovulation, we've done videos on that, you can go watch, but when progesterone's highest, we usually feel a little bit more sluggish, right? We feel a little bit more bloated and we feel a lot less sexy. And so libido tends to go down at that time in the cycle, right? So when we're thinking about this, estrogen is kind of the number one female hormone that you think about when it comes to libido. Testosterone does play a role, but studies have shown that it really plays a role in maybe helping the estrogen, not necessarily on its own. And in order to get to the point where we have a higher libido using testosterone, we have to use pretty high dosing. And progesterone, especially if we're on a lot of progesterone, might actually be really unhelpful for us. And I have definitely seen that. I've definitely had women in my office where they've been dosed like insane amounts of progesterone from other providers, and they don't feel that great, right? They do not feel sexy. Their libido is not high, and so it makes sense. So what else do we want to think about when it comes to libido, right? One of the things that we want to think about is our relationship. I know people think that we should be able to have a libido outside of this, but oftentimes when you are in a relationship, right, you have to look at, do you actually like your partner, right? Sometimes people will report to me in my office that they do have the desire, they just don't have the desire with their partner because they don't really like them that much at that point, right? And so at that point, the treatment wouldn't be estrogen, the treatment wouldn't be testosterone, the treatment wouldn't be any of those things. The treatment would be going and working on that communication so that things are better at home. We also talked about stress. So stress plays a huge role in libido, right? And it is, like I said earlier, the number one thing to go when you're stressed. And so with that, right, participating in giving yourself a little bit of grace, giving yourself a little bit of time, maybe having an open conversation with your partner, just being like, hey, I'm really stressed right now and I could use help with these things, can go a really long way. Actually, that tip can go a really long way in changing your libido, is reaching out to your partner and saying, hey, you know, I'm not in the mood because I'm feeling like my brain is doing this, and this, and I'm worried about that. Can you help me take some stuff off my plate? That'll allow for a little bit of camaraderie, a little bit of like team-based problem solving, right? Which can go a long way in creating connection. Other things that lower our libido. So birth control pills lower our libido. They have been shown to decrease testosterone and free testosterone by a lot, but in a lot of women, they actually do decrease estrogen and progesterone as well. So it makes sense, right? And then SSRIs, so antidepressants, really lower our libido as well. And that is actually one of the number one reasons why women will complain about their SSRIs, is because they just don't have any desire. And then there are some other medications to think about, right? Like if you've been on a proton pump inhibitor for a really long time, they can change the way that we absorb things like zinc, right? And zinc is really necessary for testosterone production. And so there are some other medications to think about, but those are kind of the number 1 and 2 medications would be oral contraceptives and SSRIs. And then finally, lifestyle-wise, right? People don't always like to hear this, but alcohol use definitely can lower libido. It also lowers sexual function in general. So when you do have a libido, making it a lot less successful. And then drugs and cigarette use will also lower libido, right? Part of having normal sexual function is having normal blood flow, and cigarette smoke definitely impedes that. So those are kind of some lifestyle factors that I would think about. But really when it comes down to it, I think there's just a lot of misinformation. Testosterone is not the only thing to think about when you think about female sexual desire. And actually, we should definitely be putting a couple other hormones before we think about testosterone if we want to get women back in the mood. I'll see you next time for next time's video.